Environment, Health Division. And I will open it up. Since it's a rather large budget, I kind of want to look at each of the fiscal years separately. So for fiscal year 23, to finish out this fiscal year, are there any recommendations? Representative Barth.
Thank you, Mr. Chair. I'm going to read the first one from Will Carpenter. Or that was 24. You said 23.
Yeah, we're doing 23 right now.
All right. I have a proposed amendment for the budget, for the KDHE budget, for the Division of Public Health and the Division of Healthcare Finance. And I'm going to have Megan, do you have that one? It's the proposed amendment number 1. And she'll hand one out to everybody. Okay, does everybody have one? So this amendment reads, in addition to the other purposes for which expenditures may be made by the above agency from monies appropriated from the state general fund or from any special revenue fund for fiscal year 2023 as authorized by section 68 of chapter 81 or section 24 of chapter 97 of the 22 Sessions Law of Kansas, this or other appropriation act of the 2023 regular session of the legislature, expenditures shall be made by the above state agency from such monies appropriated for fiscal year 2023. So now we kind of get into the meat of it. To provide any person receiving any vaccine or other medication for COVID-19 from a local public health department, written documentation of, 1 would be ingredients of such vaccine or other medication. 2 would include known risk and side effects of such vaccine or other medication. And 3 would be most recent information on the United States Department of Health and Human Services Vaccine Adverse Event Reporting System. I know we're focusing on 23. I would also ask that we eventually add this same proviso for 24 and 25 as well.
Committee discussion or questions?
Chairman, would you need a second to begin discussion?
Yes,
I'll
thank
second.
you. Okay, we have a second from Representative Clifford. Now we'll do questions and or discussion.
Mr. Chairman, just curious, is this not done already by public health clinics?
I do not know.
I can answer this from personal experience, that from the experience of myself with my child, that this was not done, and that no risk or concerns, no information on any of this was provided when we went to a public health facility in our county.
Representative Ruiz.
I would like to not make an amendment based on one person's experience, and would like to hear from Public Health Department as to whether this is already being done. And we're looking at budget. What does this have to do with the budget?
This impacts our budget greatly, as we have just looked over about a $400 million medical malpractice budget that we already approved for the state budget. This is something that ties to a risk factor that, as a state of Kansas, funding doctors for medical malpractice through the state, through a self-funded plan through the state, puts us at risk as a state. And this is a protection level for us to be able to disclose a full risk. I would call this more like a full informed consent bill or proviso to it. I have information from the VAERS that provides all the information on what those safety risk factors are. There's constantly information coming out on the vaccine ingredients. Actually, I was provided this by another representative that talks about that even OSHA does not approve one of the ingredients. So those are some of the factors. This is not just based on one person. This is based off of thousands and thousands of people, anyone who would be getting the COVID shots or vaccines.
Mr. Chair, connect. I really do think we need to hear from the Public Health Department before we move any further with this. Because it could be that, and they shouldn't have, but they might have not given the information to the representative. And maybe it is being done in other places. So again, I think we need to have expert opinion about this from Department of Public Health.
Representative, I don't know if we have anyone here in attendance from that, with that, in that capacity. I'm not seeing any. Yes, please identify yourself.
Outsmarting me today. Ashley Goss, Deputy Secretary for KDHE. This would be a local level issue. So any vaccine that we provide or send out, which we only do our vaccines for children, COVID, yes, we have that because it was a pandemic, so the states were responsible for issuing those. The documentation does go with every vaccine and is available both electronically, and the patient should be asked, or in your case, you should have been asked as the parent if you wanted the vaccine information. It has the side effects, it has the VAERS reporting, all that documentation is there. This would be something that would be handled at the local level. It's not something that is handled at the state level. So we don't have any say necessarily if I'm shipping this out. I'm relying on the physician or the nurse, whoever is giving the vaccine, to give out the required information, have the conversations with the parents, whether it's a COVID vaccine, a measles vaccine, whatever the vaccine is, it is the responsibility of the provider to provide that information.
So Ashley, are you aware of this being done or not being done? I think that's what we're...
Again, it's at the local level, and so I don't have any way of knowing what pieces of paper are handed out at the provider level. This, I mean, there is responsibility that comes with a provider of any kind that is administering vaccines to provide that information to the parent at the time of the visit. So I don't know. I have no way of monitoring that, no.
So if you're saying that it should be done at the local level, if it's not, then I think that's why this really should be a part of the proviso, should be added to as an amendment to the budget then, based on the fact that this is just another level of protection, that this actually does get put into place, and that it is something that's tied to KDHE, as that does filter down through to the local public health.
I understand what she's saying, Chairman, but what I'm saying is we provide that information to be handed out. What happens, though, at the local level, I don't have any way of policing that. I understand what you're saying. I hear you. But I don't have any way of making sure that this piece of paper or this information was handed to you when you go in.
You do provide it to the locals, but you do not direct them to use it, or...
They are expected to use it, yes. And that's with any vaccine, though. It's not just a COVID vaccine. That's with any vaccine.
Thank you very much. Representative Hobson.
Thank you, Mr. Chairman. Thank you for your testimony, per se. Do the vaccine manufacturers, do they disclose the ingredients they use for their vaccines?
I believe it is in the package insert. I don't have one in front of me, but yes, I believe it is enclosed on the package insert what the ingredients are.
And all of that is made available to the local level. They all have all that information. Is that correct?
Everything that comes within that box, or however the vaccine is delivered, is enclosed there. And if you would like me to get you an example, I certainly can do that for you.
Okay. Thank you, Mr. Chairman.
Mr. Chairman, I have a response to that if you don't mind.
Representative Barth.
Thank you, Mr. Chairman. I actually did my research on this and on that question specifically. So at the local public health center, I actually did call specifically to the brand and found out that there, in every box comes about 5,000 doses, individual doses. The packaging is multiple vials. It's about, I think it's 20 vials is what I was told per package. I think the insert is one when 5,000 people can receive this. So this is not happening on a regular basis. That would mean they actually have to print a piece of paper and hand it to the folks individually. Not something that's an option, it's something that would have to be done.
Regarding the ingredient list, or which list? Which documentation?
Insert.
The packaging, the insert is with the box of vaccine, and it depends which vaccine you order as to how many you get. So regarding the ingredient list, yes, it'd be one per vial, like what you're saying, and there could be 10 doses in one vial. The other information, though, comes individual, or so they can have it to hand out individually. Yes, they do not hand out the list of ingredients if that's what you're asking.
Yeah, that was one of the provisos information's listed, yes. So it would have to include that in writing.
Okay. Any other questions for Ashley before we move on? Representative Ballard.
Well, it's a little different procedure because normally once we start discussing this budget and everything else, we don't take testimony. But that is always at your discretion. I don't have a question, but I do have a comment about this. I do have some concerns because fundamentally we differ on how we think about vaccines. And as I would not want you to miss this. I would look at it by saying maybe fundamentally we different on how we see vaccines. This is kind of an unusual kind of thing here. Is this meant? Yeah, this is meant to be a proviso, of which this would be entered in our appropriations budget when we're actually presenting this. It may have a fiscal note, I'm not sure. I don't see one here. But I look at this in terms of the full committee would be deciding on this. There's some questionable things here that makes me a little uncomfortable. But this wouldn't be the first time, you know, I've been uncomfortable with one of them, but I will vote no.
Representative Ruiz.
Mr. Chair, I just don't think it is very clear. I mean, we are looking at a budget. I don't see any kind of numbers here as far as budget or anything that would be added for the proviso. This seems more policy to me. I could be wrong, but it's just how it looks like to me. So I don't even know what statute this is going to be. I see where it says section 68 of chapter 81, but we don't have the statute in front of us to understand how this is going to be added into that as an amendment, and then now it's a proviso. I think it's very confusing as to how this would even be up to a vote for us. It's not very clear to me.
Representative Barth, would you be willing to withdraw your motion to amend at this point, and then we can look at it more and then introduce it as a proviso in the full appropriations committee?
I worked with the reviser on this, and so, Mr. Chair, this is something that I was informed was acceptable as part of the proviso for this committee.
I'm just asking.
And would you be willing to accept it if I were to get that statute tied to it there and have her add that?
Are you saying today?
I could do that. I would be willing to do that.
Are you saying today or introduce it in appropriations?
Would we have time to still have it in this budget for the KDHE budget hearing?
I'm not sure. Let's suspend just for a second. Representative Donahoe had a comment.
Not a comment, but I have a question for Representative Ballard. So how would it work with the proviso? Would we pass it out here, and then you would take it to appropriations as a passed out proviso, or would we just include it and you would bring it up during the appropriations process.
Representative Ballard.
Thank you, Mr. Chairman. I'm happy to answer that. Normally, what we do when it's our day to present on the KDHE budget, we would talk about all the different things that we made recommendations here. A proviso would be a recommendation, just like we're doing our amounts of money or whatever we are in that, and then they would vote on it. We would give them written language to look at, and then the full committee would accept it as well. We can do it that way, but usually the chairperson, after we do the budget, would then make a suggestion of a proviso.
Do we vote on that?
Sometimes we have voted on it and sometimes we have not. Most of the times, we offer it as a proviso in appropriations. Yes. Yes. I think the chairperson would have to decide. I mean, he asked, would she like to, withdraw, and we could talk about it later, and I heard he indicate no, she would wanted to add to that.
To appropriations, correct?
Yes.
We don't have to accomplish it today or right in this budget. We can do it when we submit everything to appropriations.
Yes.
Thank you. Thank you, Mr. Chairman.
Representative Clifford.
Mr. Chairman, I'd move to table this with date certain of February 28th.
You say date certain, February 28th? Motion's in order. I don't know, do we need a second on it? Is there a second to, on the motion to table? Representative Hobson. All in favor indicate by saying aye. Oh, discussion, I'm sorry. Representative Droege. Representative Clifford, would you mind repeating the motion?
Yes, Mr. Chairman, the motion is to table this and with the date certain of February 28th for reconsideration.
Discussion? Okay. Representative Ruiz.
What does this do to the entirety of the KDHE budget? Does this hold it up?
Are you talking the table?
Yes,
No, we're only tabling the motion.
just the one motion. Okay.
Right.
Thank you.
Representative Ballard.
Since it seems it's going to take us a little longer to decide on this, could we, and I ask again, as the vice chair said, could we just hold up on this motion, on this proposal, and let us get through all the fiscal ones that we know we have the amount of money and everything that has to, and after we finish this, come back to this issue? Well, there's a motion on the table. If he would be willing to take the motion off of the table,
Mr. Chairman, I'll withdraw.
and what the second withdraw.
And Representative, I would be happy to present this to the full Appropriations Committee at the time that this budget is presented. I would agree to that. Okay. And Representative Clifford, you seconded the original motion. You'll withdraw your second as well?
I withdraw my second as well.
Okay.
Thank you. I appreciate it very much, and we can proceed.
Let's continue on with financial budget recommendations for fiscal 23. Are there any? Seeing none, let's move on. Oh, Representative Barth. Okay. Is it a proviso or a? Is it a proviso or is it a budgetary recommendation?
This does tie to budget.
Yes, go ahead.
Fiscal year 23, right?
Fiscal year 23. Representative, again, for this, I would ask that we present it to the full Appropriations Committee so we can get on with the business of the budget. Is that acceptable to you?
I really was looking forward to this being heard, Mr. Chair, today. So
Okay. Representative Donahoe.
Yeah, I don't know, I don't understand how you can make that commitment. We don't even know what it is yet. So I'm just saying, to commit to doing that without ever knowing what it is, I think we may end up not wanting to do it. And I would suggest if we hold off, like we have on the other one, to the time we get to submit to appropriations, and then decide as a committee or yourself as chairman whether you want to do it or not.
That's kind of what I'm asking. Representative Ballard.
Mr. Chairman, what I would propose with this one is that we hold this proviso into after we finish all of the other ones, because we have probably at least 10 to 12 different proposals that will come. At the end of that, today, in this room, we will then take this up to know what's in it to see if we wish to advance it or not. Is that satisfactory?
if you want to move that, Mr. Chair, I would be okay for it to be heard at the end of the budget then.
Agreed.
Thank you.
All right. Committee budgetary recommendations for fiscal 23.
I was.
You have one? Representative Ballard.
And instead of doing all of the ones, because as you know, I have several, I will do two and then give other people an opportunity to make their suggestions as well. Mr. Chairman, I would like to add 1.7 million, all funds, including 687,000 SGF, to extend medical adult dental coverage to include dentures and partials for FY 2024.
Representative, we were still talking about 23.
Oh, 23. Oh, well, I'll hold off on that one then.
Okay. if there are no recommendations for 23, we are going to move to 24. So Representative Ballard.
Add 1.7 million all funds, including 687,000 state general fund to extend Medicaid adult dental coverage to include dentures and partials for FY 2024.
Making that motion, do we have a second? Representative Hobson. Discussion? Representative Barth.
Thank you, Mr. Chair. Can you reference where this is in the budget that you're adding it specifically? Where that was? Do you have the page
Well,
where we were at with
Well,
the?
we don't say exactly where we're adding it. It's all in the KDHE budget. And we heard from several people about what they needed in order to do this. So when we work the budget, then they will put it in the KDHE budget of where it goes. We normally just talk about the amount. This is what they asked for in all funds. So it's not more than what was asked for. But we always include, if it's all funds, how much of that would be state general fund, and that would be 687. It will be in your letters of testimony that we heard when we had these requests.
Representative Clifford.
Chairman, I'd certainly be in support of this. It has implications for other health conditions. It makes life difficult for diabetics and other folks who have diseases requiring certain nutritional regimens. So I'd certainly be in support of this enhancement.
Thank you, Representative. And I will say that the chair supports this as well. Is there other discussion? Seeing none. Representative Ballard, do you wish to close?
Yes, I wish to close. Thank you, Mr. Chairman.
Those in favor indicate by saying aye.
Aye.
Opposed, no. Okay, that is passed. Representative Ballard, you had a second one?
Thank you. We heard an unusual project this week from Wajo Care, volunteer doctors. And what we heard from them is that they perform the unusual surgeries and everything else for people free, and surgeons and physicians donate their time. We also heard that in addition to that, they receive money from their city, from their county, from foundations, United Way, as well as individual donors come together to support our program, helping cover administrative costs and prescription programs. Every $1 of this support averages 16. What they asked for was $500,000 to be split equally between Project Access and Wajo Care. I think most of us agreed, if not all of us, that this was an unusual program. They have served over 28,000 people, and they have provided $347 million in donated health care and $12 million in prescription assistance and durable medical equipment. So I would move that we provide $500,000 to Wajo Care.
Representative, is there a second? Representative Ruiz, discussion? Representative Barth?
Thank you, Mr. Chair. As much as I think we love this program, I have a hard time with the fact that it is specific to 2 counties. And I don't see how we can fund 2 counties when the rest of the state has similar issues as well. I just don't think I could be able to support it based on that reason, that it leaves out a lot of other counties, and there are other budget things that we can do, I think, that can help.
Representative Ruiz.
Thank you, Mr. Chair. Wajo Care is part of a bigger health provider called Project Access, and Project Access serves the residents of Sedgwick. So we're adding Sedgwick too. So Sedgwick, Wyandotte, and Johnson counties that this organization helps to provide services for.
Representative Ballard, did you have another comment?
Well, I would just account for that again. We're looking at it in terms of where else do they receive their funding? They receive their funding from their county, from their city, from foundations within this area that they're serving, and they are getting their surgeons from any place that would volunteer to come and do that. So they're not being slighted. Any other county that wished to have their own local government contribute to this, their own money, and do that, they could do that in their own counties as well. We are giving our state dollars, yes, but the communities are making a significant contribution, and I don't know where else you find all these surgeons that are donating their time to their communities, and that accounts for something. So 500,000, when you're getting over 347 in return, any county could do that if they were organized and wanted to do that.
Other discussion, committee? And I will say that this was on my list of things that the chair supports. And I've had a long conversation with leadership, and there are a number of things that we believe we can do to enhance access. Any other discussion? If not, Representative Ballard, you may close.
Thank you, Mr. Chairman. I close.
All those in favor of the $500,000 to the Project Access and WIJO indicate by saying aye.
Aye.
Opposed, no. Motion passes. Representative Ballard, did you have anything else at this time?
I'll have someone else do it, and then I'll come back. Thank you, Mr. Chair.
Okay. Representative Clifford.
Yes, Mr. Chairman, I'd like to add $338,846 to fund the agency's enhancement request for the Senator Stan Clark Pregnancy Maintenance Initiative to increase case management services from 6 months to 12 months for fiscal year 2024. Stan Clark was a gentleman from Oakley, Kansas, served in the Senate for 9 years, had an untimely death driving home on I-70, and quite a unique individual, I would say. And I really feel it's important to fund this in his honor.
Thank you, Representative. Is there a second? Representative Hobson seconds. Discussion from the committee? Seeing none, Representative Clifford, you may close.
I close, move my motion.
I'm sorry, Representative Barth.
This is just actually on behalf of Will Carpenter. I think this is the same. Were you adding the 338,000 to the budget?
I believe it is the same, yes.
All right, just want to share the discussion that Will Carpenter also had provided, since he's not here today, that same information to include it as well.
Yes.
Thank you.
And I would say the chair supports this as well. Any other discussion, committee? Representative Clifford, you may close.
Mr. Chairman, I close, move my amendment.
Those in favor signify by saying aye.
Aye.
Opposed, no. Motion carries. Any other discussion, committee recommendations? Representative Clifford.
Chairman, I have additional fiscal 2024 recommendation. I recommend adding $5.1 million all funds, including $2 million state general funds, to increase the complex rehabilitation technology code to 80% of Medicare rates for fiscal year 2024. We heard yesterday or earlier that the current reimbursement to CanCare is 65%, and these power wheelchairs and other devices often exceed that reimbursement rate. So I think to provide these devices and this durable medical equipment, it's important to us to raise to the 80% of the Medicare rate.
Very well. Is there a second on that? Representative Hobson. Discussion, committee? Seeing none, Representative Clifford, you may close.
Mr. Chairman, I close and move my amendment.
Those in favor signify by saying aye.
Aye.
Opposed, no. Thank you. Any other recommendation for fiscal year 2024? Representative Ballard.
Thank you, Mr. Chairman. I think we heard from our Kansas Association of Local Health Departments. We also know that in 2020, for the first time, they had been received additional funding since 1992. So we also, our public health departments also serve as homeland security as well. They requested a 1.4 million. So therefore, Mr. Chairman, I am making the motion that we grant them the 1.4. I move the 1.4 million for 2024 for the Kansas Association of Local Health Departments, which is statewide.
Thank you. Is there a second on this motion? Representative Hobison. And discussion from the committee? Seeing none, Representative Ballard, you may close.
Thank you, Mr. Chairman. I close.
All those in favor signify by saying aye.
Aye.
Opposed, no. Motion carries.
Mr. Chairman, also, they made a request of a budget proviso, but that is already included. If you remember, they wanted to take their minimum payment from what they have, that ceiling of $7,000 to $12,000. That is already included. I was going to make that a motion, but I won't have to because it's already included in the KDHE budget.
It's already in House Bill 2273. That is correct.
Thank you.
Any other recommendations for the budget for fiscal 24? Seeing none, I have a little list here. And I would like to preference these requests with basically just a statement, and that is, regardless of our political affiliation, we're all realists here. And we know deep in our hearts and souls and minds that Medicaid expansion is not going to happen. So my number one recommendation is that we delete 671.4 million, including the addition of 71.5 million SGF to remove funding for Medicaid expansion. The all funds deletion includes 703.4 million from federal funds and 39.4 million from special revenue funds. In addition, add language to lapse the SGF funding if Medicaid expansion is passed during the 2023 legislative session. So having said that, I will say that there are many things that we can do to improve access and enhance care for these vulnerable populations. That's some of the things we've been working on, and we do have some other asks that we would put in. So I would make the motion that we strip those two lines regarding Medicaid expansion. Is there a second? Second from Representative Barth. And I know this won't be universally embraced, but is there discussion? Representative Ballard.
Thank you. You're right. We're not going to be in, thank you, Mr. Chairman, agreement on this, and we haven't been for several years. I will preface it by saying I think you have heard from many conferees that they wanted Medicaid expansion. We hear it all the time, and this is probably the third time, I think, that we've stripped that 641 hasn't gotten a workout. We have just, we've taken it out of every budget. And I was just wondering, were you going to do it in the beginning or at the end? So I knew it was coming. So it's no surprise. And one of the things, if you're prepared, you're ready for it. But at the same time, I have to say, it's not just my personal preference that Medicaid expansion would allow over 150,000 people to have insurance. And, as we sit here in the legislature and we enjoy having our self-insurance and be able to sleep at night knowing that our families and we will be well taken care of. There's a lot of people in the state that do not have that fortune. For that reason, I would think we would want them to have the insurance. You made the comment that we'll find other ways to help them. And for that, I would agree, we can find other ways. But knowing that we could get 90% taken care of. We only pay the 10% in order to ensure that many people. The argument has been that maybe the government will default on it. Well, we've depended on the government for 60-40 matching appropriations for a long time, and they haven't defaulted on that. So we need to use another excuse. I would simply say, there's many people could benefit from that. And I would almost think everyone in this room is insured. If you're not, I'm sorry, you should be. And I think everyone should have that peace of mind. I won't belabor the point because it's not going to change the vote today. But at least the people that are listening and the people will know that we heard their request, that we don't agree with not expanding Medicare. But I've been in the legislature long enough to know that it's not just in this committee. We will deal with this in the full body, and we will deal with it in the Senate. It does not make it right. There are people that need health care. If tomorrow somebody took yours away, you would feel the pain. You would feel the pain. And you would feel the pain many times over if it affected your children, or your mother, or your father, or your grandparents, or your good friends. That to say that we all need health care. And many of us are not in the position to have it, or we work in jobs that are minimum. It is our responsibility to take care of the citizens in Kansas. Thank you, Mr. Chairman.
Thank you, Representative Ballard. And you're right, there were people, conferees who did ask for this. Just being a realist and knowing it's not going to happen, just having it in the budget is not going to make it happen. It's going to take legislative approval, and that is not going to happen. But thank you for your comments. Committee, other Representative Ruiz.
Mr. Chair, I first want to thank you for allowing us to have a discussion. Nowhere else in our legislature, no other committee will allow a discussion. I know this is not a hearing, and I thank you for that because we're the only ones free enough to be able to do that. The legislature does not have the stomach to do this, but I think we do. And it would just take a few legislators from both sides of the aisle to make this happen. So I need to say that because I know personally that we would have the votes to pass Medicaid expansion. Let's talk economics. I mean, Representative Ballard talked about access to health care, and we can talk about that all day long. But let's talk economics. You know, we heard from Community Care Network of Kansas, who's doing phenomenal work all across the state. They've already told us they've got 30% of their patients are uninsured. And they have spent over $40 million at least of uncompensated care over the past several years. And if we had Medicaid expansion, they could recoup at least anywhere from 17 to 18 million. So just from an economic standpoint and an access to health care, it just makes sense for us to pass Medicaid expansion. We all know the reasons for it, it's just a travesty to me that we cannot pass Medicaid expansion. But I thank you again, Mr. Chair, for allowing us to have a discussion.
You're welcome. Thank you. Committee, other discussion? Representative Clifford.
Yes, Mr. Chairman, for transparency as a physician, I would benefit personally from Medicaid expansion, and I will vote, but I just wanted to know for transparency's sake that I'm in a position of benefit.
Very well, thank you. Other discussion, committee? Well, you heard the motion. All those in favor say aye.
Aye.
Opposed, no? Opinion of the chair, the ayes have it. The ayes do have it. Okay. Representative Ruiz, Representative Ballard, Representative Hobson. A no vote. Any others? Thank you. Let me move on to number 2. So the next request, or the next recommendation I have, is to add $10.8 million in all funds, including $4.3 million SGF, to increase the Medicaid physician fee schedule by 5% for fiscal year 2024. This increase includes the 17,254 codes for which physicians currently bill. So this is one way that I'm looking to enhance access. Is there a second for this? Representative Ballard. Discussion, committee? Representative Clifford.
Chairman, these enhancements are long overdue. As you know, in many communities, physicians and other providers no longer take Medicaid patients because the rates are too low, and frankly, sometimes it would cost us money to see folks on Medicaid. And we see everyone in my practice, and again, from a disclosure standpoint, my practice would benefit from these enhanced fees, but I will vote because I know how important this is to patient access.
Yes, and this is part of the reason we're doing this, is because the physicians do not have to accept Medicaid patients, but hopefully with this they will accept more. Any other discussion, committee? Seeing none, you've heard the motion. All in favor signify by saying aye.
Aye.
Opposed, no. Motion carries. Let's move down my laundry list here. I recommend that we add $5 million all funds, including $2 million SGF, to increase emergency medical service ground ambulance rates to 100% of the rural Medicare rates for fiscal year 2024. Is there a second? Representative Ballard seconds. We heard from the EMTs that many of those organizations are struggling, who are out in the rural communities, and some of these are folding, and so that just means that the ambulances are having to go farther to get to their destination. So we believe that this will help keep more of those ambulances running and help them serve more patients, including Medicaid patients. Discussion, committee? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed, no. Motion carries.
Mr. Chair, just a point of order, and I'm not totally familiar with procedure, but does the chair have to move a motion that he makes or she makes, him or herself?
I don't know the answer to that. It's not clear.
I'm happy with the way you're doing it.
Yeah. Yeah.
Okay, the chair can make the motion, but the chair still has to get it.
Yeah. We're all powerful.
And if you notice, I seconded to make sure he feels powerful.
All right. Bear with me, committee. I have just a couple more items. I move that we add $5 million, all SGF, for the primary health care projects and community-based primary care grants for fiscal year 2024. These are your community health centers that work on all comers. So they take people, whether you have the ability to pay or not pay. They take private pay. They take insurance. Many of these organizations have a lot of uncompensated care because of the walk-in traffic who are just unable to pay. So I would make that motion and look for a second. Representative Ballard? Representative Ruiz, seconds. We have
Just a second, I think he's second.
okay. Discussion, committee?
Discussion? I'm in favor of that one, and that was on my list, but we split them up so that, we wouldn't be all doing the same. And again, I think because we look at how much, if you're treating over 334,000 patients, and you see them on the ability to pay, without the ability to pay, and then you think of it in terms of your uncompensated, care is great, and yet there's no way we can handle all of that ourselves. So you have these clinics out there that are making it possible for people to get this care, and it's extremely important. So I'm pleased that you have given some funding to them as well, so they can continue to do good work to the people that really need it. And again, not to belabor the point, if we're not going to have Medicaid expansion, we are finding ways. And that's why I said in my testimony before, we will find ways to make sure, but these organizations also will be providing in the meanwhile. So thank you very much.
And I think that's the entire point, knowing that we will not expand Medicaid. I believe that there are ways that we can improve care and improve coverage and increase access.
Until we decide to expand Medicaid expansion.
I beg pardon?
No, I said until we decide to do it. Go ahead.
Committee, other discussion on the motion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed, no. Moving on. Should be a quick one here. I move that we transfer $938,756 from the State General Fund for the Kansas Tobacco Use Prevention Program, and this is from the Juul settlement, as you recall, for fiscal year 2024. Do we have a second on that? Representative Barr seconds. Discussion, committee? Being none? Wait.
Could you repeat that number that we're reappropriating?
$938,756.
Is that approximate, or did you? I'm just kidding.
Yeah. There might be a few cents, but I rounded up. Okay. All those in favor indicate by saying aye.
Aye.
Opposed, no? Okay, and last item for me, and then I'll just turn the rest of you loose. So part of my concern has been the rural hospitals and their uncompensated care. So I am moving that we add $20 million, all SGF, to hospitals in rural opportunity zones. And I add the language directing the agency to distribute these funds based on the volume of uncompensated care by each eligible hospital. And this is also fiscal year 2024. Do we have a second on that? Representative Droege. Committee, discussion, questions? Representative Ballard. I did.
I'm supportive of that. And part of that is because of the need. And I think will make a difference. I just wanted to say I was pleased and support it. Thank you.
And as you all know, when someone walks into an emergency room at a hospital, the hospital cannot turn them away because of an inability to pay. So they must take all comers. Many of these hospitals are writing off hundreds of thousands, if not millions of dollars a year in uncompensated care. And this is not going to make them whole, but it can chip away at it. Representative Clifford.
Thank you, Mr. Chairman. I appreciate this enhancement. I have 5 rural hospitals in my district, and some of them are actually using their 340B money to compensate uncompensated care. So I think this is a great way to do that in the RAS hospitals.
Committee, other discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed, no. Motion carries, and I'm done. What else?
I think we have another motion.
I know, I'm done. I'm just telling you, I'm done. Are there other recommendations? We don't do 25, do we? What's your recommendation?
Yeah, but this, my recommendations for 2025. Yeah, not for 2024. It's allowed, he's the chair.
Representative,
I'm fine, and we apologize. It was a conversation I had to have with the chair about an issue. I am fine, thank you.
Representative Ruiz, can we hold that just for a little bit? Okay. Are there other recommendations for fiscal year 24? Representative Barth?
Yes, thank you, Mr. Chair. Is this when you would like for me to go over that proviso at this point?
That'd be fine, yeah.
All right, thank you. I think everybody has this in front of them now as well. This one's kind of long, so I don't know if you want me to read all of it. If you want me just to kind of highlight it, I can do that.
Yes, please highlight it.
Okay. So this is a proposed amendment, and I have this titled Safe and Effective. It's for KDHE, Division of Public Health and Division of Healthcare Finance. I have this for fiscal year, I have it 23, 24, and 25 technically on this document here. This would provide for, let me go to the right area here. Provides all public information produced, published, and otherwise distributed by such agency concerning COVID-19 and any vaccine or other medication for COVID-19 to remove any reference to such vaccine or other medication as being safe and effective or words of like effect, provided that such expenditures shall also ensure that any new public information distributed does not contain any reference to such vaccine or other medications being safe and effective, or other words like effect. So another number 2 item would be new or newly revised public information. It would pertain to that concerning the United States Department of Health, Health and Human Services, vaccine adverse events report, and information urging people to consult their healthcare provider concerning COVID-19 and any vaccine or other medication for COVID-19. The above agency shall require any local health department that receives any funding from the above agency in fiscal year 2023 to implement the provisions of this subsection. And basically it goes in to say that on the bottom of that first page there, then so really the agency would have until October 1st to be able to basically make this information change online as well, and shall certify the amount of monies to be expended on marketing and outreach by such agency, if any account in fiscal year 2024 shall transmit. So basically just saying that, you know, this is something that's going to be no longer online or on any of the materials, and that the amount certified from the state general fund in the identified account or accounts is hereby lapsed after that date. Really, this is just to go back to last year, the Senate Judiciary Committee had a hearing, and it was in relationship to KDHE, and the Senate Judiciary Committee at that time had any advertisements be removed that had anything that stated that the COVID vaccines were safe and effective. This is expanding basically onto that also would require other materials that also had that type of content as well.
You're making a motion to pass the proviso.
Move that we accept this proviso that I just read, and that one that we have in writing here.
Is there a second? Representative Droege? Committee discussion. Representative Ballard?
Thank you, Mr. Chairman. You read from that, but would you look up and tell me exactly what does this do?
This would require that any of the information that's online for KDHE, if you were to go to their website, any printed materials, anything that is a PDF online that has the words safe and effective as it relates to the COVID-19 vaccine information that's spelled out in the document here.
I can, I'm opposed to this kind of language. Because it's more of a personal reaction to vaccines or lack of vaccines, or professionals that have studied for years in research and are knowledgeable about medical conditions, physicians, dentists, and everyone else, that I have confidence in KDHE and all of our agencies in the state that work on behalf of all Kansans in our state. And I just don't feel that this is really it's somewhat misleading. And I think there's a lot of people around the state take direction from what we do as legislators. And I guess my other comment would be, is this really necessary? And what good does it do when we know that so many people died as a result of COVID? And we didn't have a vaccine. And we went through a period of time that people were praying that we would develop a vaccine. And we developed a vaccine, and it saved so many lives where those people before didn't have it. And then to talk about the vaccines now when we were so grateful to get it. And no one should be forced to have a vaccine. We should willingly receive it. I guess I just disagree with the language. And I will vote no.
Representative Ruiz.
One of the things thank you, Mr. Chair. One of the things that our chair said earlier when he was taking away Medicaid expansion funding, and he was very eloquent with that, with saying that no matter what our political stances are on whether we believe Medicaid expansion should happen or not, that, we need to basically look at things as trying to look at some things as neutral. And this is one of those instances too. Public health is public health. I mean, part of what they do is give information, and they help access to health care. And whether we agree or not with the vaccination protocols that were out there for COVID, whether we agree or not that COVID even exists, whether we agree or not that people die from COVID, whether we agree or not that vaccines actually help people, doesn't help you from not catching necessarily, but it will help you from dying from it. And COVID's just one of many vaccines that are out there. It just doesn't make medical sense, really, to have, to force a Department of Public Health to do that. I will not be a part of that, and I will definitely vote no on this. Thank you, Mr. Chair.
Committee, other discussion? Representative Droege.
Representative Ruiz, thank you, Mr. Chairman. Representative Ruiz and Ballard, you're very eloquent. And I think part of the, what I interpret out of this is, yes, there are lots of other vaccines, and they are good vaccines. They've been proven, but that's the case. They have been proven. They were tested. They weren't put in a fast track. Vaccine makers are immune from any lawsuits. You know, that when these things came about, Moderna had never brought a vaccine to market. There's a whole list of things that are wrong with the corona vaccine, especially since people were suppressed from even discussing it. I made my living with vaccines, but that doesn't mean that every vaccine is good. And my concern is, and I think that to protect the people of the state of Kansas, you're absolutely right. The health departments have bent over backwards and done really good things, but I don't think that they've been given the right information to deal with this. And I think people need to be made aware of that instead of just led on down the road and told that it's safe and effective when it's not been proven to be safe and effective, and they find out every day more and more things. Yesterday they came out with a new, they found an ingredient that nobody will approve of. The day before that they came out with an increased P waves on airline pilots, not allowing them to fly. You know, you have to have an airline pilot has to have his electrocardiogram ran, and the P waves were extended without even discussing why. So they're just, and I'm not saying that that's a final word. I'm just saying that there's so many words out there that haven't shown that the corona vaccine, and I used the term vaccine, you know, it is not in a vaccine. There is no approved vaccine that's open for use in the state of Kansas or in the United States. It's still under the pandemic emergency protocol. So why shouldn't people be allowed to know that this is not always, just because the CDC or the KDHE says that this is true, doesn't mean it is, because there's been so much stuff suppressed over this deal. That's all I have at the moment.
Representative Donahoe. Representative Clifford.
Thank you, Mr. Chairman. While we were talking, I looked up the package insert for a typical vaccine, and it will be what I'd like to show as evidence for one of my objections. I have two objections to this. I do think it's well-intentioned, but I think it's already being done. The measles, mumps, and rubella MMR vaccine package insert, 8 pages, which I'll admit patients often don't read, but to which they do have access. And the first sentence in bold highlights the prescribing information. These highlights do not include all the information needed to use MMR safely and effectively. Right off the bat is what it says in the package insert. Further down on that page, it says reports suspected adverse reactions. To Merck, it gives the phone number, and also to VAERS, and it gives an 800 number and a website. And then at the bottom of page 8, I'll spare you all the intervening pages, which do include the ingredients. It says to the provider of the vaccine or the physician, 17, it's section 17, patient counseling information. Advise the patient to read the FDA-approved patient labeling, patient package insert, and discuss the following, and has 7 bullets. So this is already out there for patients, and I think doing this is redundant. It also, my second objection is it falls into my category of the 66612 solution for local problems. If you don't recognize that area code or zip code, it is the zip code of the capital, and it's we in Topeka telling local folks because we don't think they are able on their own to do these things, and we would direct it and usually at their cost. So I would recommend voting against this. The information's already out there, and we should not be imposing Topeka solutions on local health departments. Thank you.
Representative Donahoe.
Thank you, Mr. Chairman. My concern is with the statement safe and effective. What is a safe and effective vaccine? Are you requiring that there's no adverse effect at all to anybody that ever gets this? I mean, we just can't have a vaccine like that. I mean, it's never going to happen. So what are you willing to accept as an acceptable death rate? I'm not sure we want to put it that way, but adverse consequences. What is acceptable? Because to say safe and effective is, you know, it's meaningless in that you've got to quantify in terms, which I think we should do to the people. I think the people should be aware. I think there was a lot of things that the people weren't aware of. They found out later. Part of that is, you know, that it was rushed through and fast-tracked and everything. But again, my problem is with safe and effective and no quantifying of what that actually means. Thank you, Mr. Chairman.
Representative Ballard.
You know, thank you, Mr. Chairman. You know, I would add, you know, every time, let's say I get a new medicine and I read the insert that's in my medicine and I know what it's supposed to help or get rid of, and then I read the side effects. Well, when I'm reading the side effects of what this medicine might be, I might just, you know, I go, I don't know if I want to take this medicine or not. I mean, but I see all those side effects that are there. And then I realize, but I need to cure this one that I have. And so I take my medicine. I am looking at that in terms of their being honest, because they have spent 10 to 12 years on research in order to do this. But in this case, we were hoping, praying, and demanding as citizens of the United States that we come up with a vaccine. And they did, but I don't think they would have ever issued it if they thought it was going to be harmful to people. It's do no harm. It's how we might interpret it. But what I do know is that people are not dying today at the rate they were dying when COVID was there and people were really scared to death. But I don't think there's any totally safe medicine we can take. And certainly, people have their own opinions, and I'm not going to change your mind, and you are not going to change my mind. And that's the way people are. And we live, we vote by what we believe. And I have never tried to change anyone's belief.
Representative Thomas.
I think it needs to be said here, and I respect the representative from Garden City, but I'll say this. He made a comment that I want to just briefly talk about. He said that people in the Capitol or in Topeka, and I assume in politics in general, shouldn't be doing things like this to tell local officials what to do. And the issue I have with that is, during the entire pandemic process, as soon as these vaccines became available, that's exactly what happened on a local, a state, and a national level. We had mandates. We had employers requiring it. We had the very thing you're talking about at a state and a national level, which I would honestly blame for the reasons for both sides of this. Because on one side, you've got groups that are saying, listen, this is a medical vaccine, the research went into it, and that's fine. But the other side of it, I've never seen, and someone can correct me, I am only 40 years old, I have never seen a vaccine used as a political talking point or in political commercials or in political debate the way we saw this vaccine. So to be fair to both sides of this issue, that's the reason for this dissension, is because of exactly what you were talking about. I think at a national level, and even in some ways at a state level, politicians actually created this mess for why we're here debating why vaccines are safe and effective. So I would say I agree with you that when it comes to a lot of the public health, the politicians should stay out of it to a certain degree, but they didn't. And I think that was a huge mistake at a national and a state level. Just my opinion.
Representative Ruiz.
Thank you, Mr. Chair, for the second time here. The other thing is singling out one vaccine on a website or in printed materials, everything that this amendment talks about. It's going to be hard for people to not think that that is true for all of the other vaccines. And, you know, it's difficult enough at times to get, you know, folks to know that vaccines are effective. You get vaccines when you're a child, you get them when you're a younger person, get them when you're older. I've had, I don't know how many vaccines because of my age. They are been proven to be effective, but again, my concern is people are going to look at this website and it's going to raise doubts regarding all of the other vaccines, and I think that might be an unintended consequence of this, and so again, I will not vote for this. Thank you.
Representative Droege.
I agree with you. Thank you, Mr. Chairman. Representative Ruiz, I agree with you to a large extent, but there's sometimes I think we need to speak up because do you remember the thalidomide babies? You know, everybody thought that was a great drug, and it created huge problems in loss of born with no arms and legs. Well, you know, if we have a concern about a particular vaccine, I think we should say something about it, not just say, well, I think they worked really hard at it and they mean well. It doesn't mean that I agree with the outcome.
Representative Clifford.
Yes, I'd just like to thank the representative from District 26 for supporting my position of non-interference with locals.
All right, committee. Representative O'Halverson.
Thank you, Mr. Chairman. Thank you, colleagues. I think we've had a very healthy debate here, discussion. If I recall, with respect to the vaccine, once it came out, I think every manufacturer published their effectiveness, whether it was 90%, 80%, 70%, 60%. So there was a gauge as to what the effectiveness of every vaccine. So it goes back to what Representative Donahue talked about in terms of safety and effectiveness, right? As to what do you accept? What's your range? If the research is already there as to a lot of research has gone into the effectiveness of the vaccine that was already published. I wonder what the threshold should be for anyone to accept the fact that a vaccine is effective or not effective. The issue here is whether or not the public is informed. You cannot say that, well, because of any vaccine or because you may disagree with a particular vaccine or if it's fast-tracked, therefore information should be withheld from the public. COVID-19 was a very unique virus. We know that. Representative Thomas is correct. There were some people, politicians, national, state level, that decided to hijack the process. So there's blame on both sides, and I agree. But the fundamental question is a particular information made aware to the public, which is the effectiveness of every vaccine that was actually done. The research was done, they published the results. It's nothing that was like classified, no. You're absolutely correct, doctor, when you said that they're finding out different things about it now. That's true, but then again, you have to realize that there are different variants that are still coming out. So one vaccine may not work on a particular variant, therefore they have to go back. Same thing with when I believe it was either measles or whooping cough. I think there was another vaccine that first came out, then there was several variants that did come out. So again, I'm gonna oppose this because I believe that the public should get information as to what the results are when research is done. A lot of time has been put into it. And KDHE and CDC, there are a lot of experts that work in these particular agencies and organizations that they give their lives to their work. So with that, you know, I'm going to oppose this on this particular proviso, and I'm going to stick with my good friend Representative Thomas and say that, you know, some of us politicians should just stay out of it and let the expert do their work. Thank you.
Committee, anything else? Seeing none, Representative Barth, you care to close on your motion?
Yes, thank you, Mr. Chair. First and foremost, I have to say how excited I am that we're actually able to have a discussion. For the last 3 years, we have not been able to have a discussion, and it has been so disappointing to me that we cannot even talk about this, that social media has suppressed information and really not allowed for information that was known from the get-go to be allowed to even for the doctors even to have the information, for public health to have the information, for the CDC to have the information. I agree with one of the other representatives who said that, you know, that some people don't believe COVID exists. That is not the case here. It does exist. That should not be forced. I agree it should not be forced either way. I also agree that it's misleading. I think safe and effective is misleading based on experiences. So I have the VAERS report here. You know, there's over, just as last year, there's over 24,000 people that died from the COVID vaccine that reported these deaths. And there's more on here too that I can share. I think this is something everyone can look up and do some research on as well. I know this is highly unreported or underreported. I can also tell you that the information around this is, you know, it's not new. I actually did, you know, I don't think this will probably surprise our secretary of our KDHE department, because we've had calls on, I've had a call before on this as well, and also had talked about it in addition during a tour of the facility as well. I know that they hear me as well in the concerns with it being safe and effective. This has hurt people that I know when we believed that it is safe and effective. My family, my daughters, having a, I don't want to say it on here because my kids won't want me to say it, but something that affects their life every day for 2 months in a row, a health condition that should not exist, because my doctor and everybody else says it's safe and effective for marketing reasons. I truly believe. The data on the research of this, the study that they did was literally an unacceptable study of how studies should be done. I know it was done in a quick time frame, but that's also, I believe, been redacted at this time as well. I do believe there needs to be more education done on this. I do think that this will affect our medical malpractice insurance as well, as we are giving out something that can cause harm potentially to folks. And, you know, this has been from the top down. We have heard from a national level, the CDC, we've heard from Fauci, we've heard from Biden, you know, that we've been told things like this is something, you know, will protect us from transmission. Well, that's not true. You know, so we've had a lot of non-truths, and I think it's time for us to be able to have the discussion, to be able to talk about these things. And the fact that it goes back to is that we do have safe and effective all over our websites. And I know people who have died from the shot. And so that is not safe and effective. I think it's the swine flu. It might have been 20 people that died from that vaccine alone, and they ripped it off of the market right away. What changed with this one? So I'm not saying that it might work for some people. I think there's a lot to be studied still, and I wish we would really focus on that as well going forward. I know there are several that won't support this, but I still stand with my motion to.
You're doing your motion?
Yes, this,
Okay.
Meaning I want to still have my motion in place, yes, so we can vote. Yes, thanks.
Yeah, well, but, yeah, to renew the motion would be to close then. Okay, committee, you've heard the motion by Representative Barth. All in favor indicate by saying aye. Opposed, no.
No.
Opinion of the chair, the noes have it. The noes do have it, motion fails. Committee, is there anything else on a recommendation for the KDHE budget? Fiscal year 24. Seeing none, could I get a motion to pass the KDHE budget out? Representative Ballard.
Mr. Motion, Mr. Motion, Mr. Chair, before I make this motion, let me say, oh, and now you've been called all kinds of things about Mr. Motion, right? But let me just say, you know, I've been on this committee for many years. We discuss in depth a lot of things, as Representative Reed said, that other committees don't discuss. And I think that's the nature, because we're health, we are social services budget. And I think the chairs have allowed lots of freedom. And the people in this committee have always participated and been able to voice what they believe and what they feel. And that is always important, that we feel comfortable enough on a committee to voice what we feel and what we believe. That's who we are as people. And whether I may disagree with what it is, I have to say how much I have appreciated having that freedom, because then we're representative of at least various parts of Kansas. So thank you for that. And with that, Mr. Chair, I move that we accept all of the motions made for the KDHE budget
For fiscal years.
for fiscal year 23 and 24.
Second from Representative Hobson. You've heard the motion. All in favor signify by saying aye.
Aye.
Opposed, no. Budget passes. And may I say, thank you for this vigorous debate and the fact that we were all cordial and polite. I appreciate that very much. Yes. All right, committee, I'll direct your attention to the hearing we had yesterday for the Kansas Parsons State Hospital and the Kansas Neurological Institute. And this is a budget for, again, 23 and 24. So are there recommendations? Boy, we know how to clear out a room, don't we? Committee, recommendations on fiscal years 23 or 24. Representative Clifford.
I didn't want to stifle any debate, but I don't have anything to add, and I'd like to move this budget, unless someone has something.
Okay, it's been moved by Representative Clifford, seconded by Representative Ballard to move the State Institutions for Mental Health budget for fiscal years 23, 24 favorably as presented. Any discussion on this? Yes. Intellectual, yes, I'm sorry. Any discussion on this? All in favor, signify by saying aye. Opposed, no. Thank you, committee. Let's move on to the next thing. We have a budget analysis now on the Institutions for Mental Health, correct? And I'll call Dayton Lemunion to the podium.
Thank you, Mr. Chair, members of the committee. Should have a document, a budget analysis in front of you that says State Institutions for Mental Health at the top. The current year analysis will begin on page 8. For fiscal year 2023, the amount approved by the legislature at the end of last session was $123.9 million including 102.4 million SGF. Subsequent to the legislative session, there was an SGF reappropriation of $22,000 and a state institutional building fund reappropriation of $250,000, resulting in a final legislative approved amount of $124.3 million, including $102.5 million SGF. The agency revised estimate includes a supplemental for $625,000 SGF for increased contracted food expenses at Larned State Hospital. Additionally, Larned State Hospital requests $34.2 million SGF for contract agency nursing staff expenditures. And number 5, you see the expenditures for the 24/7 pay plan totaling $14.3 million. This amount was approved by the legislature during the last session, and it has been transferred from KDHE to the state hospitals in fiscal year 2023. Moving down to the governor's recommendation, the governor did not recommend adoption of the $625,000 SGF for contracted food expenses. Instead, she recommends the agency fund that with their savings from the FMAP continued enhancement. Additionally, she does not recommend adoption of the enhancement request for contract agency nursing staff. This results in a fiscal year 2023 amount of $137 million, including $116.8 million SGF. And I'm happy to stand for questions on 23.
Any questions on 23? Seeing none, please proceed, Dayton.
All right, we can turn to page 11, which is the budget year 2024 analysis. The first 2 items that you see, contracted food expenses and contract agency nursing staff, are continuations from the previous year. There's a $0 amount there because they're not requesting additional expenditures beyond what they requested in the prior year. Number 3, Larned State Hospital requests 6 FTE positions and $745,000 SGF. This would allow them to create the nursing house supervisor position, which would supervise the facility on nights and weekends, where they currently do not have supervisor coverage. Number 4 and number 6 are for salary increases, similar to what we saw in the state institutions for intellectual disabilities. They request a total of about 3.1 million SGF to fund those. Additionally, number 5, Larned State Hospital requests $91,000 for firefighting equipment. And the governor did not recommend the nursing house supervisor or the salary increase requests. Additionally, she did not recommend the contracted food expenses or contract agency nursing staff for this year. She did recommend the addition of the $91,000 for Larned State Hospital for firefighting equipment. This results in a final amount of $125 million, including $105.6 million SGF. And I'm happy to stand for questions on the budget.
Committee questions for Dayton? Seeing none. Thank you, Dayton. So let's hear from Scott Brunner, Deputy Secretary of Hospitals and Facilities. Welcome.
Thank you, Mr. Chairman. My name is Scott Brunner. I'm the Deputy Secretary for KDHE for Hospitals and Facilities. Thanks for having us back again today, or having me back again today, to talk about the other state hospitals. And you'll hear from the superintendents here. I won't belabor, given the hour. In the slide deck that we've passed around that's addressed to you as a committee, it's got some information, background information on the purposes of Larned State Hospital and Osawatomie State Hospital. And again, the superintendents are here to talk through that in detail. I would just point out in that slide presentation on page 4 and 5 is information similar to what I showed you yesterday about the budgeted bed capacity by program at each hospital, and staffing, and then the vacancy rates and turnover rates. And hopefully you'll notice that the vacancy rate in particular at Larned and Osawatomie are significantly higher than they are at KNI or Parsons. Much more FTE positions, more bed capacity, those kinds of things. And we'll go through more of that as the superintendents go through their presentations. The funding is similar to what we talked about yesterday. There's general fund money, and then there's Medicaid revenue as well. We can go into more detail about that if you have questions. But with that, Mr. Chairman, I'd like to bring up Lisa Dittman, the superintendent at Larned, to do her presentation.
Yes, please.
Okay, thank you.
Welcome.
Thank you, Mr. Chair, committee members. My name is Lisa Dittman. I'm the superintendent for the State Hospital at Larned, and I just wanted to express to the committee that Larned State Hospital does have 3 distinctly different programs. We have the Psychiatric Services Program, we have the State Security Program, and we have the Sexual Predator Treatment Program. The Psychiatric Services Program, which is a civil care and treatment program at Larned, admitted 642 patients last year and discharged 533. On slide number 12, there are 3 graphs that are related to the waitlist data for that program. A waitlist was necessary 228 days last year, and it was for an average of 55 hours of wait time for those that were on the waiting list. On the next slide, it shows admissions to this program by county, with the largest numbers being admitted from Saline County with 72, Reno County with 55, Ellis County with 52, Barton and Ford counties both with 36. The second program at Larned is the State Security Program, and that program serves adult male and female patients charged with crimes that are ordered to Larned through the district courts across the state for competency evaluation, competency restoration, treatment of confinement, and also individuals that are found guilty due to lack of mental state. That program also houses a 20-bed security behavior unit for male individuals that are aggressive from either the Psychiatric Services Program at Larned or from Osawatomie State Hospital. On the next 2 slides, slides 15 and 16, you'll see three graphs that are related to the wait list for the State Security Program. The first table, or the first graph, I'm sorry, is defendants that are on the wait list for the last 2 years. It shows those numbers. And then the next 2 graphs, they show the average length of time on the wait list for the males as well as the females. Admissions by county to the State Security Program are represented on slide number 17. It shows the highest number of admissions coming from Sedgwick, Shawnee, and Wyandotte counties. The third program at Larned is the Sexual Predator Treatment Program, which is our largest program. These are individuals that are admitted through the Sexually Violent Predator Act. This program currently has 286 residents, with 233 of those in the inpatient program, 16 on conditional release in the community, 9 are currently in the custody of Department of Corrections, and 29 are in reintegration facilities at Larned, Parsons, and Osawatomie. On slide number 19, it shows those same numbers, but in graphs, and then it also lists on that same slide the number of complete discharges from that program. And you will see that there was an increase in 2022. There was an increase in the total number was 5. Staffing continues to be a struggle at Larned. However, we do continue to recruit. We're using a wide variety of social platforms and digital advertising. We've participated in virtual as well as in-person job fairs. We have an active campaign with KSN airing commercials. We have Facebook ads, streaming TV ads, as well as audio ads. We've also tried to be creative. We've converted some of our full-time positions to half-time positions to allow for greater flexibility of hiring individuals. We offer flexible interviewing. We interview individuals by Zoom, by Teams, in person, as well as by telephone. Larned State Hospital is still an APA-approved site for internships and postdoctoral training for psychologists. We also continue to have a variety of employee recognition events through the year. We do have an on-campus daycare to try to provide some daycare for employees. And annually, we have 2 educational scholarships that are awarded to our staff through the endowment fund. On slide number 22, it addresses mobile competency for the State Security Program, which is outpatient. We have partnerships established with 33 counties thus far for mobile competency evaluations as well as restorative treatment in the community. We have partnerships with Douglas, Geary, Leavenworth, Sedgwick, Shawnee, and Wyandotte counties, providing competency restoration services in the jails. Similar pilot projects are being developed with Butler as well as Johnson County. Looking at slide number 23, the number of outpatient or mobile evaluations and competency treatment completed by county is on that slide. We've continued to make security enhancements throughout the hospital. We upgraded the security software on one of our secure buildings. We hired an assistant superintendent to focus on and to manage security and safety concerns across the campus. We've installed mobile high-sensitivity middle and cell phone detectors on our secure buildings. We also have safety and security officers that have been involved in transporting our high-risk sexual predator residents off campus for appointments. In 2022, there were a total of 1,549 transports of those individuals that were required to go off campus for a variety of appointments. We have been working on fencing improvements, with the Dillon building being our highest priority. We've also installed door alarms on all of the external doors at the Adult Treatment Center. On slides number 25 and 26, it does list significant changes in the approved budget. Given the number of vacancies in each of our 3 programs at Larned and the high-risk populations that we serve, the hospital has had to rely heavily upon agency nursing staff in order to safely staff our units. We've also seen increased costs and in food prices, just general goods and services, as well as hospital supplies, fuels, maintenance. Our sexual predator population is an aging population because it's a long-term program, and we've also seen increases in medical costs. There is an enhancement request recommended in the governor's budget for Larned, as noted in the slide deck on slide 27. For fiscal year 2024, the governor recommended an enhancement of $91,000 from the state general fund to provide 10 sets of fire protective equipment and supplies for our safety and security officers. And with that, I will stand for questions.
Committee questions for Lisa? Seeing none. Oh, I'm sorry. Representative Clifford.
Thank you, Mr. Chairman. Yeah, this is a real race here. I saw the governor had denied the enhancement for agency nurses. Am I reading this budget correctly? And yet he spent $32 million or something last year on agency nurses. How might you staff without that money?
What I'll do is I'll defer to Deputy Secretary Bruner for the question, if that's okay.
Sure.
Scott Bruner with KDHE. So we put in the budget what we needed or what we're projecting to spend through the fiscal year. And the governor at this point didn't include it in her recommendation. We are going back at the governor's budget amendment time with another request. We were asked to see if we could refine the estimate to see if our number from when we put the budget together in August, but for September submission would be different, or if we've been able to move the trend. Honestly, we haven't moved the trend that much. We've renegotiated the contracts. We've gotten some different pricing. But the trajectory is pretty much the same. So we'll go back here in a few weeks when we were allowed to ask for a governor's budget amendments and make another request. In the meantime, we're directing funds that we've got within the agency across the other campuses as well to make sure Larned can keep paying the bills that are coming for those agency nurses as they're working. And we'll see what happens in the governor's budget amendment process and in this process.
Thank you for your answer. Thank you, Mr. Chairman.
Committee, other questions? I think we're ready for phase 2. Ashley? Welcome. If you'd identify yourself.
Yes, my name is Ashley Byram. I'm superintendent at Osawatomie State Hospital. Osawatomie State Hospital has 2 psychiatric hospitals on grounds, Osawatomie State Hospital and a day acute care. Osawatomie has served the state of Kansas for more than 156 years, currently serving individuals from 45 counties and other states. 47% of our patients served by Osawatomie and 87% of our patients served at AAC present with co-occurring substance use disorders. OSH is licensed for 116 beds through KDHE for acute intensive inpatient treatment and criminal court commitments. A day acute care is CMS certified for 60 beds for acute intensive inpatient treatment and social detox, where we have 3 beds. Both of our hospitals have semi-private rooms. However, there are times when a patient due to medical necessity needs a private room. Therefore, that does impact the number of beds available. On the next slide, you'll see the Osawatomie State Hospital admissions by county. As you can see, the largest county was Douglas County at 24 admissions, Sedgwick as 23, Shawnee and Johnson at 22. The next slide is the Adair Acute Care admissions by county for the last calendar year. The largest county was Johnson with 278 admissions, Wyandotte at 135, and out-of-state individuals was 83. Next slide is our waiting list. We do have a continued waiting list the last calendar year. You do see some peaks due to COVID as our units had to be closed for isolation and quarantine due to COVID. The next slide is our number of cases admitted from the wait list by month. Our average length of time on the wait list, not including our competency cases, for the past calendar year, as you can see in December, it was 31 hours. For Adair Acute Care for our fiscal year 2022, our average daily census was 30. Our number of admissions was 1,007, and our discharges was also 1,007, with an average length of stay for 11 days. For Osawatomie State Hospital, fiscal year 22, our average daily census is 98, which already this year has increased to 103. Our admissions were 175, with 179 discharges, with our average length of stay as 244. So our agency's initiatives, we follow the Franklin-Covey process. So we have these widely important goals, which we call WIGs, which are work groups established to quickly resolve identified issues. In the last year, we completed several projects, which included our Pyxis project, which we implemented these medication dispensing devices for all our units on both hospitals. We have our Crisis Prevention Institute, where we trained all our staff on our advanced holds in order to keep our patients and staff safe. We have been working on safety to improve the safety for staff and patients by engagement, streamlining paperwork, documentation, improvement of communication in regarding to safety measures. We also have implemented a new policy informs platform in regards to policies and procedures so that all our staff are informed of any changes in policy. Our current programs that we're working on are recruitment and retention. We've broken that down into several different key areas, including advertising, education, incentives, recruitment of physicians, coordinations of interns and teaching, and staff recognition and appreciation. We've been working on our communication, both internal and external to the hospital, and along with our HR department. Focusing on active treatment to ensure that all our units are providing active treatment and developing specific program manuals for each unit. We've also been focusing on our AWOLs to ensure that all staff are aware of what to do in case an AWOL should occur, and implementing regular drills, and ensuring our search efforts are more efficient. On January 3rd, 2022, OSH lifted the moratorium on voluntary admissions, which had been in effect since 2015. Since that time, AAC has admitted 20 individuals on a voluntary status. OSH has not admitted any individuals on voluntary status, as OSH remains over 85% of the capacity. When that hospital reaches 85% capacity, voluntary admissions are suspended in order to manage the bed capacity. Upon lifting the moratorium, this included adding our social detox program. Since January, AAC has admitted 4 individuals to that program, 3 from Miami County and 1 from Montgomery County. Due to the increase of individuals requiring competency evaluations, Osawatomie State Hospital has reorganized a 30-bed unit to focus solely on competency evaluation and restoration. So currently, Osawatomie has 2 30-bed units to provide the service. These competency beds will aid in decreasing the wait list, so individuals are not sitting and waiting in jails. In order also to assist with the competency evaluation, OSH has been collaborating with Larned State Hospital to determine if there are individuals on their wait list that we could admit at Osawatomie State Hospital to help with that competency evaluation and/or restoration. The 2 hospitals have been collaborating since June in this process, and since that time, OSH has taken 16 individuals off that wait list. 9 of those individuals have completed their competency restoration and have returned back to jail to complete their legal obligation. We've had several different remodels in the past year. We had a B2 remodel, which we did occupy this unit in April 2022. We also had a C1 remodel, which we did do a light remodel, deep cleaning, some painting, and also increased our medication room so that we could add that new Pyxis machine. We have an East Biddle remodel, which is coming up. Anticipated construction to start this month with a completion date of January 24, which will then add 12 beds to the hospital. So between AAC and OSH, we will have 189 beds. Significant changes in the approved budget. Our food costs have stayed steady at the facility. Our current food costs through December of 22 have totaled $825,730 and are projected to total $1.5 million fiscal year 2023. This will be a 235 reduction in fiscal year 2022. Our current direct care agency staffing costs through December 22 have totaled $6.9 million and are projected to total $14.4 million fiscal year 23. This will be a $2.3 million increase in fiscal year 2022. And with that, I'll stand for questions.
Questions for Ashley? Representative Ruiz.
I have a Pyxis question.
Okay.
You've had a medication room, right? No Pyxis?
We have not. We've had the old medication cart dispensing system for years.
When did you get the Pyxis machines?
We just got those last year.
Oh my God. All right, thank you.
Representative Ballard.
That's progress. We're getting there. Please freshen my memory. I'm looking at this. When you say B2, and under the remodeling, I'm drawing a blank. What is B2?
So BT is just another unit that we had at the hospital that needed several different renovations. So we did, that unit had been closed. So it had 26 beds, and so we were able to open that. So we renovated that. We moved patients from a unit C1 over to B2 to renovate that one. And now we are getting ready to renovate East Biddle, and we moved patients from East Biddle over to C1, so we can renovate that unit.
That's what I was looking at.
So,
Picture B2 because it was never open.
right.
Now, where is that in relation to the rest of it? I mean, was it that whole wing that was closed?
Yeah, so we have a B building, which had B1 and B2, because we have several different buildings on campus. So we have A building, B building, C building, and then Biddle. And so B2 was next to B1.
Did you also remodel the dining facility?
We're getting ready to do that with this East Biddle remodel project.
Now, it is in need.
Yes.
So they are going to do that.
Yes.
How many are in the B2 wing?
26.
And what kind of patients are they?
On B2 is kind of more of our vulnerable population, so individuals that are over 55 and have some medical conditions along with mental health needs.
Mr. Chairman.
Representative Clifford.
Hey, Mr. Chairman. I really appreciate the cooperation with Larned State Hospital to do these competency evaluations. I mean, because I know what the backlog's been, and it affects us, and it certainly affects our sheriff in Finney County and in other counties, as we've seen in the news. But are you able to do telemedicine, telehealth competency evaluations? I know we seem like we proved some language to allow that.
For the mobile competency for Larned State Hospital. At Osawatomie State Hospital, we are not doing those at this time.
So you arrange a transfer
Yes.
and you do it there. So that's great. I'm glad to see. And when you look at where people are waiting for competency evaluations, I didn't realize people would bond out who needed competency evaluations. Pretty amazing. But are most of them in jail, or are they elsewhere in hospital emergency rooms? Where are they waiting?
Most of them are waiting in jails.
Okay. Thank you for your answers. Thank you, Mr. Chairman.
Other questions, committee? Representative Thomas.
I would like to ask on behalf of the man to my right and the man to my left, who came up with the term wigs?
Franklin Covey.
Okay. All right. Thank you, Mr. Chair.
Alarming absence of hair on this corner. Representative Ballard.
I don't even know if I have a question now, but no, seriously. You probably know, but it was this committee that actually requested the proviso in budget that you do a comprehensive study on how to reopen Osawatomie from 2015. And so we're saying January of 2023. But what I saw was no one has actually been admitted voluntarily. They went to the acute, but is that right? That because it's over census, we haven't been able to, but the whole point, I think, when we said, when it closed in 2015, and for the new people who you understand, they closed it because we didn't meet all of the qualifications that we needed to have at the time. Then we went through the remodeling and we did that. But we closed it to people voluntarily going, so we do it through, physicians or law enforcement or whatever. But then when we opened, it was be based on if there was room for the voluntary people. Do I have it correct so far? Okay. So have we had people apply? We just didn't have the room. And if that's the case, where then did those individuals go?
So we do have the two hospitals, which are completely separate, because our AAC is CMS certified, and they have admitted 20 voluntary individuals. So that's still on campus, it's still a part of the state hospital, it's just our CMS certified beds. So we have admitted those individuals with the lifting of the moratorium in January.
So we have
admitted at least 20. Mhm.
We have admitted at least 20.
Yes.
And again, for the new people in this committee, there's a difference between certified beds and licensed beds. And that's where we got in trouble, basically. I'll have you explain it so I don't have to do it. But I think it's important that you know the difference between licensed beds and certified, because there's a big money difference.
So we had, in 2015, the state hospital did lose their certification, which means they were no longer receiving their Medicare and Medicaid funding. So at that time, all the money was coming from the state. So at that time, we were the very first hospital in the nation to be certified under those new ligature-free standards. And we had to completely redevelop everything from the door hinges to the screws that we're putting in the outlets. And so we were only able to do that on our 60-bed program. We were hoping to do it throughout the hospital, but financially we could not. So we did 2 30-bed units. And then we asked CMS that we would become our own separate hospital. So in 2017, Adair Acute Care was certified as CMS. Now for the Osawatomie State Hospital side, we are licensed through KDHE for 116 beds. That side of the hospital does not receive any funding from Medicare and Medicaid. So those are the 2 big differences between the hospitals.
And certified is when we get federal dollars.
You get the federal dollars for that 60-bed unit.
But you can still have license, but we're going to pay for it.
Yes, correct.
So that's why it's important to be certified, because we get that 60, is it 60-40 or 70-30? 60-40, 60-40 match. Mm-hmm. And that's really important. So when we closed, we were paying, what, pretty close to $1 million?
Yes.
A month?
I believe.
A week? What?
So $14 million a year to run AAC.
Yeah. So you see, that's why being certified and making sure you meet all of the regulations, that saves us money, and we're able to admit more people. Okay. Thank you very much. Thank you, Mr. Chairman.
Committee, other questions? Seeing none. Scott, do you have final comments? Okay. We'll move on to the next part. Thank you very much. Next, I would call Michelle Ponce. Welcome to committee.
Thank you. Good evening, Chair Mason and members of the committee. My name is Michelle Ponce. I am the Associate Director for the Association of Community Mental Health Centers. I'll be very brief. Our membership does consist of all 26 licensed community mental health centers in this state. They make up the safety net for individuals with mental illness. Likewise, our state hospitals are the inpatient safety net for individuals with severe mental illness. Our community mental health centers have a unique statutory relationship to the state hospitals in that they are, by statute, the gatekeepers to admission to the state hospitals. The mental health centers are responsible for conducting screenings to determine when an individual requires the level of care provided by the state hospitals. That also means when no bed is available, it falls to the community mental health center, and I believe the language is to provide a suitable place to detain an individual. Oftentimes that may mean an office, it may mean a hotel room, often it means an emergency department. And the mental health center is responsible then to ensure that the individual's safety until a bed does become available. For several years now, both state hospitals have operated with waiting lists due to various different census management strategies that they've had to put in place. So our ask is very simple. The state is really at a critical need for additional inpatient resources. We support increasing inpatient capacity either through returning our two state hospitals back to full capacity and or some combination of implementation of the additional 50 beds that are being explored in South Central Kansas. The one caveat I would add to that is that any expansion of beds must be developed in conjunction with strategies to increase workforce. New beds mean new workforce is necessary. If we increase the number of bed capacity but no new staffing, we will just draw staff from our existing beds and it would ultimately be a wash. With that, thank you again for the opportunity to address you, and I would be happy to answer any questions you may have.
Questions for Michelle? Seeing none, thank you.
Thank you.
And our final conferee, Amy Campbell. Welcome to committee.
Thank you, Mr. Chairman. My name is Amy Campbell. I work for the Kansas Mental Health Coalition. I've been coming before the legislature and talking about state hospitals for almost 20 years. If you look at the testimony that I have here, I don't have to go over it with you. Suffice to say, we agree with everything that Michelle has said, but I want to point out that I did some research to look at where we were on state hospital beds historically. In 1975, kind of mid-mental health reform, we had 1,300 mental health beds operated at state hospitals. 10 years later, it was down to about 1,200. In 2018, if you looked at the 2019 Mental Health Task Force report, it was 256. Now we're just north of 200. We're going the wrong direction. So the only way that the state can operate and not have folks having to wait for hospital beds is to do a number of things that'll come up when you get to the KDHE's budget, things like state institutional alternative beds, things like this 50-bed expansion, and other things like that. They're all mentioned in my testimony, and I just want to, before I sit down, commend the folks that are here today that do work at the state mental health hospitals. Staffing there we are very understaffed, millions of dollars for contract staff. So I thank the work that they're doing. Thank you.
Questions for Amy? Seeing none, we'll close the hearing on the budget hearing for state institutions for mental health. And just want to thank the committee again for respectful discourse. And I know we talked about a lot of issues today, but we were calm and collected and respectful, and I appreciate that very much. I want to extend appreciation to our co-host for filling in for the vice chair. And we're adjourned. We'll see you Monday.